the following: an upright or table bucky, 10 by 12 inch cassettes, 14 by 17 inch cassettes, protective lead shield for the patient, an assortment of lead markers, an X-ray generator and X-ray tube housing assembly, a control panel located behind a protective lead barrier, and a computer radiography system. To obtain a radiograph of the chest and the PA projection, select a 14 by 17 inch cassette and orientate it crosswise in the upright bucky. Proceed to set the source to image receptor distance, or SID, to 72 inches. Turn on the collimation light and align the central ray to the center of the image receptor. Collimate to the cassette size. Select the upright bucky setting and the large focal spot on the control panel. Set the exposure parameters to between 110 and 120 kilovolts, or kV, and 2 to 4 milliampere seconds, or MAS. Position the protective lead shield over the posterior aspect of the patient's reproductive organs. Ask the patient to stand with the front of their chest touching the image receptor, IR, and their shoulders rolled forward. Align the central ray to the level of the 7th thoracic vertebra in the mid-sagittal plane, or MSP, and then align the IR to the central ray. Collimate the light field to 1.5 inches above the shoulders and include the lateral soft tissue borders of the chest and the diaphragm. Instruct the patient to raise their chin. Position the inverted left lead marker on the upper left corner of the image receptor within the light field. Stand behind the protective lead barrier. Check that the exposure technique is appropriate for the patient's body habitus and, if necessary, make any adjustments. Ask the patient to take a deep breath in and out, then take another deep breath in and hold it. Expose the cassette by pressing the prep button. Then, when ready, press the exposure button. Once the exposure is completed, inform the patient that they may relax and breathe normally. Remove the cassette from the bucky for processing. For a lateral chest projection, place a second 14 by 17 inch cassette lengthwise in the upright bucky. Select the appropriate exposure factors. Ask the patient to stand sideways with their left side touching the image receptor and to raise both arms above their head, bending them at the elbows. Reposition the lead shield on the right-hand side of the pelvis. Ensure that the left shoulder is touching the IR and the patient is in a true lateral position. Align the central ray to the level of the 7th thoracic vertebra in the mid-coronal plane, or MCP. Collimate to 1.5 inches above the shoulders and include the anterior and posterior soft tissue borders of the chest and diaphragm. Prepare and expose the cassette on the second full inspiration. Review the images for both projections.